know who that is that's in the room, but
All right, well, it's 1 o'clock. I'll go ahead and get this edition of our Animal Welfare Advisory Committee started.
Do you want to turn on the video?
So first things first is, we need to approve our agenda, but I think we need to make a few modifications before we get going. One of the things is I like the way we did it last time where we had the public comment following the approval of the minutes. And then, after old business, we will have our response to public comment. Is that good with everybody?
Yeah.
Are there any other additions or changes that we need to make to the agenda at this time?
yes, we do have to discuss the work plan, which I have up on the screen.
We're gonna do that. Do we want to do that in old business?
Yes.
Do you want to do that first thing, or where do you want it to be in old
Be
business?
first thing, it'll be quick.
The work plan, is that our
Yep, the annual work plan
and list of
accomplishments.
accomplishments? Okay. Any objections to that?
I moved to approve the agenda with public comment as number 4 and the work plan as 5.1.
Do I have a second?
Second.
All those in favor signify by saying aye.
Aye.
With that being said, we have approved the agenda. Has everyone had an opportunity to review the minutes from our February 12th meeting?
Yes.
Do I have a motion to approve those minutes?
Motion to approve.
Do I have a second?
Second.
All those in favor signify by saying aye.
Aye.
Motion carries, those minutes are approved. Moving on to new business, I will turn it over to Director Johnson for staffing updates.
Okay,
I'm sorry. Prior to that, public comment. Is there anyone in the room? Please raise your hand if you have any public comments. I'm not sure if we have anybody on Zoom that would like to speak during public comments. Do we have any way of checking that? Okay, seeing no hands, and hearing no voice, we'll now move on to new business and turn it over to Director Johnson for staffing updates.
sure. So, okay, first, before I do this full staffing updates, I'd like to welcome Dr. Stevenson, who is here. She is our shelter veterinarian. And she's gonna come and talk about a few things, as well as share some pretty cool stats with you all. And I'd also like to welcome County Attorney Franklin. She is assigned to Animal Resources now, and so we're really excited to help to have her. She has been done all of our cases and a rock star in several of them. So I really appreciate her expertise in guiding us through some of the difficult cases that we've been having. So just wanted to at least do that introduction for y'all. I don't know if you've all met. I know many of you have not met Dr. Stevenson before. She also has her master's in forensics. So she does all of our necropsies and forensics exams for any of the cruelty cases we have and is in court all the time for us as an expert witness. So we appreciate it. Besides that, we're now down to 2 officer vacancies only, and that's because one officer promoted back into investigator. So we only have 2 officer, positions open, 2 kennel staff positions open. And we did hire a shelter supervisor. She's gonna be coming to us from another county. She won't be joining us until June. She has asked that I don't share all the details yet until employers have been notified. So we're very excited about that. So we're making headway on our staffing, so we're going to.
That's been a while.
I know, yeah, it's been amazing. So, yeah, so we're pretty excited.
Are they coming from somewhere in Florida?
Yes. Someone. So,
Do you want to talk about Deb too?
Oh, Deb Fuller, oh my gosh, I am so grateful. I have an admin coordinator, I'm so excited, 3 years. So my admin coordinator position has been filled. I literally buried her in redoing all of our SOPs for the shelter. Because they were, we had solid SOPs, but they really needed to be brought into this, kind of revamped and re-looked at and just redesigned so it was easier to read. They were very clunky to read. The information was correct, but it was just a very difficult read for our staff, especially new staff coming on board. So we're trying to shorten things that were redundant and things like that to try and make it a little easier to read. Because when staff do onboard, there's several hundred pages of policies they have to sign at the county level. And then we have them sign our SOPs on the shelter level as well. So it's a lot of reading for new staff. So just trying to make things more efficient. But, very
What does
excited
that
on that.
position entail?
Which position? So she is my assistant, but also trying to help us develop. My direction has been to help us really redefine some of these policies and procedures to make sure that they're really in line and that they still matter. That's part of it. As we move forward on, which I'll talk about as we move forward with some of the other priorities that are coming up, then she'll assist me in getting that done as well. And then eventually she'll be taking over my calendar, which I'm probably most excited about. Because most of the meetings that get placed on my calendar, I don't place them there. And so it's constant whack-a-mole with, no, I'm actually not here. Can't meet with you. So I'm very excited to have her help me with that. So yeah, we're very excited. Thank you. As breeders licenses and registration, I wanted to touch on this with all of you because the county commission really wanted us to enforce these breeder registrations and regulations. And I agree, I'm wholeheartedly behind it 100%. The problem is it has been mostly complaint driven because we don't know who's breeding behind closed doors. We have no way of knowing. And the other roadblock is that we'll see for sale, puppies for sale. You all see them on the side of the road. We can't get an address. And when they see animal resources, a lot of times on the caller ID, they're very smart not to pick up. So trying to find a way to actually ascertain addresses has been challenging. In a lot of these, what we've noticed more and more is that when you're calling these numbers, they're those Google voice over IPs, so they're not even legit phones. So we're not going to get an address, under any circumstance. So trying to really ask the public's help to really help us drive the complaints, but with addresses has been challenging. So we need to find a way somehow. So we want to enforce it. We want to find these backyard breeders, but it's so far it's been complaint driven. And that's still a challenge. But wanted to at least, touch base on that we do have that. It is in place. I'm hoping to do some more marketing around it, so to speak, or kind of a did you know campaign. If you're breeding an animal in Gainesville, or Alachua County, you need to have a permit. It doesn't matter if it's one litter, you need to have a permit. So trying to come at it from a different angle, I think would be helpful. Hopefully. So that's kind of what's happening.
How many do you have registered? One.
And he self-reports. And he is on time every time. Sorry, it's Dr. Levy. It is every time. He absolutely pays for everything. Oh gosh, it's not on her calendar. Sure, she can log on my Zoom.
Is that one a commercial breeder or a hobby breeder?
Both.
Both.
So we have permits for each.
But the one you're talking about that's self-reported, that's a
He's a commercial breeder.
commercial breeder.
Yep. And I mean, on time with vaccines, on time with licenses. I mean,
Maybe he can be the spokesperson for the program.
no, we have some concerns about this person.
Okay.
So It is our Archer case.
Hmm.
Yes, so, we think that's why we self-report so much, so,
So no one comes around.
and we come around all the time.
Yeah.
So I think he knows that he has to. Oh. Gilly, can you send Levy the link to the Zoom?
Yes.
She's trying to log in. So I think that, there's another motivation there. I'm glad we have one. So, but if you do see anything where you guys notice an address somehow, please let us know. We'll be happy to follow up.
Imagine if I were to call interested in one of the many multiple poodle
Right.
mixes. I would meet them in the Walmart parking lot.
That's what
How
they're
I
doing.
feed the dog.
I mean, they know.
But then somebody needs to follow their vehicle or see what the vehicles.
We're not really allowed to, so too bad. So that's out of our purview. You can't
That's
stop
like a
people.
call that's not from the animal services.
Even if I hit *67, it's just they take it as a voicemail first and then they call back.
That's like a good one.
Yeah.
And then you have to identify yourself.
Can't do it.
Maybe,
Because unfortunately pets are considered property, right? So. That's the problem. So it's a conundrum. Unfortunately. I know, that's the thing is I'm like, how do we get addresses tied to the phone numbers? I think that's the biggest thing, right? So that's kind of where we're at. But if you do by chance see
I
anybody,
think that people that live next door are afraid to complain because they have to give their name.
yeah,
Yeah.
I mean, but it's just for a permit. It's not like we're citing them. It's just that we're gonna give them the breeding regulations that they have to comply. So
I understand that, but that doesn't mean that they're not gonna be jerks to their neighbor who calls.
that's true.
Oh, still.
Yes, they are.
And then what about the unhoused breeders that we have? Like around the grace area and some of the camps over on Berkshire,
I'm sorry.
like the unhoused,
Oh, yeah. What are we doing with those?
yeah,
We are not. Again, we have been so full at the shelter. We do
Yeah.
not have the bandwidth to take on more than we're taking.
yeah,
I have 50 open cases right now that we are actively working with animals. And so just trying to add that and figure out how we're going to get animals in and out during that same time
Yeah.
is next to impossible. Because what's happening is they're closing out. They go after one encampment, which we assist Leo's on all the
right,
clean out
I've
calls.
been there.
So, but the problem is they just move down the road. They
Yeah.
don't always claim ownership. So it depends on when they claim ownership. Once they claim ownership, we can't touch them.
They talk about the breeder specifically.
Yeah,
Oh,
the ones that are breeding in woods, like purposely.
we can certainly cite them. We can certainly give them citations.
But that's pretty.
But the
much it.
problem is we have to have an ID.
Right,
If we're gonna issue a citation, they have to have some form of ID. Which many times when we talk to them, they say they do not.
right,
We can't force them. They don't have a car or license plate or anything identifying that we can tie them to.
Yeah.
So that's a problem.
What's the consequences of being in violation? Fine? So there's no criminal,
No,
just a fine.
just still fine.
Sounds like the ordinance doesn't work.
The what?
It sounds like you need to tell the Board of County Commissioners that their ordinance doesn't work. It's not enforceable.
It's, I've always said that is like when people make rules, but they're not enforceable, it's like. You really have to have, it has to have more, it has to be something that is actually gonna work where people aren't trying to get around the system, because that's what they've done so far, right? That's why we have all these breeders, is because they stay, behind the curtains, right? They don't come out, and it's not like they're sitting in, like before, years ago, they used to go out in the Walmart parking lot and sit there all morning trying to off puppies in the parking lot, you know what I mean? That used to be normal, and they don't do that anymore. So, I think the intention is good, and I think that the reasoning behind it is good, but it is challenging to enforce.
And it's not like this is a tool that you can use if there's another issue, because this seems like a low hanging fruit. If there's another issue, that's something you can cite or.
Correct.
Criminal charges.
Right,
This not even can be used for anything like that.
right.
Okay.
I mean, again, we go after them with fines and things like that and hopefully stop them from breeding. But even then, who's to say they don't get a different dog a week later and just do it differently?
Set cameras everywhere and.
Right.
And public fences.
Right, right,
What I'm seeing is they're getting a dog, a random dog. Breeding it. Getting the puppies.
right,
The puppies go God knows where.
right.
I mean, they go all over
They
the
tell
place. Yeah, with no shots,
Yeah.
no vaccines, no nothing. And then they keep one of those puppies, then they breed that dog.
Yes, inbreeding is,
Yeah,
yeah.
it's just,
I mean, we're happy to cite for that. I mean, we're
Yeah.
happy to cite, but we just need to know where and, all of that stuff.
you know,
But again, the citations have to have identification on.
I
that we
would,
have to
yeah,
list for the
I
court.
don't think that means a whole lot to.
yeah, no, it's,
grand scheme.
Right.
Is there anywhere that this works? Is there any other place this has been tried and it works?
Dr. Levy, you've been involved in the breeder permit regulation fight for a very long time. Where have you seen it been so successful?
That's a rough one to pick. I mostly hear about frustrations that people have. Like in Miami now, people are just like have a pickup truck and they go park in a street and sell puppies. There's, like you said, no healthcare, no health certificates, any of the statewide rules that people are supposed, there's already laws at the state level people are supposed to comply with, but they don't. And then very often, like if they get cited, they just give the dog to their brother, right? And now it's a whole new business and you've lost the ability to follow up on that. It's not something I'm deeply involved in, but I am not aware of any really successful programs. It might be worth checking in with the ASPCA and HSUS lobbyists in Tallahassee, because this is a topic that they follow and they work with communities on their local ordinances. So they may have an example that really works.
I can call Kate.
Yeah.
Yeah.
So with the violation, would it be a violation for each animal?
Yes.
Offered for sale?
Yes.
So if they got 5 puppies
Right.
and they're trying to sell 5 puppies,
Right.
it'd be 5 violations. And
Correct.
what's the fine on that?
I'd have to pull it up on the animal ordinances.
Because my thought is you make the fine stiff enough.
We have to go by the civil penalty, so I think it's
Okay.
271 first offense, 500 second, or,
That's pretty stiff.
yeah. it's
So,
not-
one maybe outside the box idea would just be to have someone undercover. It'd probably have to be somebody sworn.
Yeah.
That could go
I might know someone.
and
And
then respond to the for sale. And then boom, there we go.
Yeah, but how are you gonna get it over on the Google Voice over IP? That's what I'm saying. We don't have an address. They're using a fake phone number.
Well, what I'm saying is, but you have to meet at some point.
Yeah, to get the animal.
Right,
For
and
the
there's,
transaction, yeah.
and
Yeah,
without just laying all investigative tools out there on the table in a public forum,
yeah,
there could be a way to make
I like it.
something like that happen. Now that we're educating anyone who may be watching this
yeah, I think that's
Uh,
fantastic. I really appreciate that.
for educational purposes.
Okay. We're just providing examples.
That's right.
Yes.
So anything else for breeder licensing and registration? You have any questions, comments? Moving on to old business, and I think we're gonna jump right into so we can get it knocked out. Our previous work plan list of accomplishments, we need to approve that as a committee before it can be presented. I believe that we are currently on the agenda for an October meeting, to present the accomplishments that this committee has done. So, not printed up in here, right?
Correct.
Okay, so we're up on the.
It's up on the
screen.
Zoom screen.
Dr. Levion, can you see, you have a split screen, can you see it? Perfect, perfect. I'm not gonna read that word for word if everyone could take a moment and glance up. Is everyone ready to scroll down?
There you go.
Get to the meat and potatoes of it there.
This is what we had actually discussed in the November meeting, or November or December? November.
Is that the end? Is that the bottom line? Yep. Okay, so does anyone have anything there that has been missed that we've thought of since this was prepared? That we might need to amend and add to this?
What's the review of animals at fairs last year?
That was year before.
previous year, yeah.
So I was actually, I was here for that.
Yeah.
I might be older than.
Yeah, that was-
Well, no, because what was strange was
That's
it
the
across
fiscal year.
years, yeah,
Fiscal year.
yeah,
October, okay.
yeah.
We want to invite Jenny to come and give a presentation about the housing research she's doing.
Yeah, definitely. She came to the one meeting, but I know is she getting the findings now?
Oh, sorry, I must have missed that meeting, so sorry.
It's okay.
Okay, so as far as our list of accomplishments and our goals, I'm not hearing any edits or amendments to this. So this is what will be presented to the Board of County Commissioners and currently scheduled for the October meeting to present this list of accomplishments and upcoming goals. Of course, we should maybe be about knowing the goals by October, but
Correct.
but either way, do I have a motion to approve this as this is what the committee wants to present to the county commission and in that scheduled meeting? Do I have such a motion?
I don't know.
I have a hearing a motion. Do I have a second?
Second.
Got a motion and a second. All those in favor signify by saying aye.
Aye.
Moving on to shelter data and metric discussion.
Dr. Letty's gonna help us kick this off.
Yes, so can I share my screen?
Yes, let me stop sharing. Wow. There you go.
All right, so the purpose of transparency and shelter reporting is to allow us all to understand shelter dynamics, which have changed every year. There's new challenges and new opportunities, and we're always moving towards the goal of all of the community services and life-saving that we're here for. And without good data, it's very hard to understand what we need to work on the most, what are the biggest challenges. And so for a very long time, probably from the time we started the No More Homeless Pets Coalition here back in 2000, then started the Big Maddie's grant that brought all the groups together and required shared reporting. The county has publicly shared their summary data of the shelter's results, and the other partners did as well. Some of them continue to do that, and some of them have stopped reporting on their publicly. But what Maddie's Fund required at the time is that we work with the Asilomar Accords, and this was the first national agreement on how shelter data should be reported. And it was a great movement. It made us as a community meet with veterinarians and everybody to decide on how we would clump different conditions as adoptable, treatable, or treatable manageable, which meant it was chronic, or untreatable and unmanageable. And what they were trying to guide everybody to at that time, back in the early 2000s, was our goal should be to save all the adoptable and the healthy animals and the treatable animals. And that just seemed reasonable. And then we, would get into the weeds, like, is a FELV positive cat treatable or untreatable? We decided they were treatable. And so I'm going to screen share what it currently looks like on the website and talk about the pros and cons of the Asilomar Accords. So let me see. Oh, I need to send a request to Sarah.
You're in.
Okay, I'm gonna put over here. Can you see my screen? You don't have to read the words. This is what it looks like now. Can you all see that document?
No, we can't see that yet.
Oh, I need to share. How about that? Can you see it now?
It says,
Oh,
there we go. Yep.
There's
And
a
it's
lot.
in the packet. It's in everybody's agenda packet.
Oh, okay. Oh, good. So you can follow along, probably easier to read. But the bottom line is what the Asilomar Accord requires is that the assessment at the time of intake and at the time of discharge to go into one of those categories of healthy, treatable, or untreatable. And that is a subjective assessment. And a lot of times these subjective assessments, especially at intake, they're made by frontline staff who are very busy, don't have a lot of time. They can't do a full exam and behavior test and everything at that time. So they make their best guess. And then at the time of discharge, there's more information. And so, it might be revised. They might be called healthy at the time of intake and then manageable or unmanageable at the time of outcome. And sometimes that's frustrating to readers because they're like, oh, you're just changing, the status to justify euthanasia rates or something. And that's not the case. It's just we learn, oh, they had heartworm. We didn't know that at the time, or, oh, they got parvo and that changed. But one of the issues is that subjectivity of what category we put them in. It still gives you the raw data, which is really important. I'm just screen sharing right now, right off of the ACAR website. So this is what's up there now. And they post monthly reports. And what I don't think is currently posted is an annual report, which is something you can do. You can add up all the months and then have, well, no, it is, I think, actually, the end of year, this actually, take it back. This is an annual report for 2024, which is helpful because some shelters actually just show all the monthly ones, and then you're like, oh, to add this all up in a spreadsheet. But this is the way the data looks for ACAR, whether animals are coming in from the public or through the field, breaks out owner-requested euthanasia, transfers, all of these normal things that we're looking at. What also I know some shelters really like, and it's not in here. It's got the animal counts at the beginning and end of the year too, which is really important because it helps us understand the volume of animals that they're caring for at that time. What I am not seeing, Julie, is I thought that you displayed, here it is right at the top, the annual live release rate. And this year it was 91%. And this is a standard that is promulgated by the Asilomar. So the calculation is done automatically. It does not, there's no shadiness in the sense that the shelter can change this number or that it's not transparent how right there, you see it doesn't include the requested euthanasias that were unhealthy and untreatable. One thing I don't like about this is it doesn't count the animals that died in shelter care. And to me, that's such a crucial statistic. It mostly affects cats because of kittens that die in care. And so I think those should be included in the calculation of live release rate. So anyway, that's the standard that's been there around a long time. It hasn't changed in decades. So what I'm now going to show you is, if you're not familiar with Shelter Animals Count, this is the new national database, and they have become very tech savvy. So there's a lot of APIs. You can join this. It's voluntary to join. And there are APIs that will just automatically suck shelter data up into their system and then update your reports live. Or you can go in manually and enter the data. And we really do encourage everybody to sign up for this and contribute your data and hopefully display the data for your rescues and shelters, but at least contribute your data. You don't have to share it publicly if you don't want to. But we do think that all organizations should be transparent. And then if you do that, you can also join our Alachua County Data Coalition. So we can add all of our data together and understand how we're doing as a community, because that's so much more important than what individual organizations do. Like everybody has their specialty, and so they're doing a little corner of this work, but we can't understand the needs of our community unless we add it all together and see what needs to be done. So this is just a really good webpage to know about. They do reports, they do deep dives into data because of the API that's taking real-time data from like Shelter Love or Chameleon or PetPoint or any of the big organizations. They actually do a lot of research they have line item data on every animal, so they can really drill down deep into lots and lots of animals across the country. And they're always refining this and making it better and more complete. And so that also is a value of using their system, because you only have to link to it once. And then as it grows and becomes better, it's automatically you don't have to go in and update anything. So I'm going to show you now. This is how there's a dashboard that you can link your data, your account, to this dashboard that we'll post on your website. And I know that Humane Society of North Central Florida displays this. And then I also picked Jacksonville Humane Society just here because I look at their data occasionally. And so what you see here, you will notice this is the year 2025. This is to date. So right now it only goes through April because it is live data and they post it month by month. So what you see are the intakes of cats and dogs, the outcomes, and then down here it kind of breaks out what kind of intakes they are and what kind of outcomes they are. So that's very transparent. You can see, if you click through all of these, you see the exact numbers for that time period. And then down here, it's the same data in table form. It's a little more detailed. So anybody who really wants to know the nitty gritty, currently that is available there. So really helpful. And it's also broken down by age. So you see puppies and kittens broken out separately from adults. Now, what I also like is you can filter by year. So if we want to look at what happened last year, click on last year, and I can filter by species. So let's say I only care about, look at all those different species they have, which are nothing but cats and dogs are present in the Asilomar cords, but we can look at everything they take in. So I just want to see cats last year. And this tells me that the Jacksonville Humane Society, all of their data on cats, and you see that kitten season spike and the outcomes. And this does break out the died in care and lost in care, which also negative outcomes. So what it does not do, though, is they do not propose a way to calculate a live release rate. So if you want that, you would have to use a different system to come up with that number, or just define it transparently how it's calculated and add that to the website. So they specifically do not do that because they try to be a very open and trusted resource. And because there's such a lot of drama around how you count live release rate, they're just like, we're just gonna let organizations decide what they want to do. We're not going to make a national standard for that. There is no national agreement. And so they don't report that, but they have come along with the national agreement on all that very detailed glossary they have of statistical calculations. So this is just the straight shelter intake outcome data, which we're used to seeing. What they have also built, because it was recognized that shelters do a lot more than take care of animals in their shelter, and none of that effort was being accounted for or shared with the public. And you could imagine, right now everybody's chasing this 90% live release rate as a national number that's kind of in people's heads. But you could imagine when a community is really successful and they're not taking in animals in the shelter anymore unless they're dangerous or, on the brink of death. And they've developed a lot of public clinics and spay neuter and other things to help the community with their needs. We will not see healthy animals flowing into animal shelters anymore. We're only going to see the problem ones. And so you might see super successful shelters start to have higher euthanasia rates because they're only getting in the animals that are, in dire condition. And so what they did was they built a whole nother dashboard, which is their community service dashboard. It's not as widely used as this one because it's a little bit trickier, but it will report like the number of calls our officers go on, the kinds of calls, how many TNRs you do for the community, all these different things that shelters are doing that right now are not recognized or tabulated. So you also have that option to add a community services dashboard. But I think a lot of times the way you record data now in PetPoint or in your dispatch system may need to be like more work to synchronize it with the community dashboard, but something to put on the wish list for long term. But my suggestion for now would be to connect with Shelter Animals Count, get signed up with them.
We are linked, Levy.
Pardon?
We are linked with them.
With Shelter Animals Count?
Yes, ma'am.
Oh, yeah, yeah, I think I knew that actually. And so all we need to do now is like do whatever IT is needed to publish this on the website if that's what is selected to do. So you're doing the hard part already. I think now it's just data display. And you could do both. You could, like, if you like the Asilomar Court, there's nothing wrong with posting both. But I think this is easier for people to look at. So that's what I was thinking.
I'm cool with posting both if that's what the committee would like. Because I do think people are so attached to the live release rate of seeing that percentage. They're so attached. Even though I tell people like, don't get attached to that number because we never know each month what's going to come in. One animal can take you out of the 90% range. Yeah. So, but I think displaying both, the more data we display, the better. I mean, that's fine by me. I just have to have keep it a link on our website. But we are on there. You can go in and search our data currently.
I motion to add that to the website.
We got a motion to add that to the, like a link or whatever. Second, all those in favor signify by saying aye.
This also is more shareable with the public, if you want to use social media, you want to tell a story about like kittens use it or something. One of those graphs,
they would be the
that.
graphs, yeah.
Yeah, rather than this.
Great. Happy to do it.
Was that the end, Dr. Levy?
That was all I had.
All right, thank you so very much. Moving on to pain protocol.
I have a question about this. So I was looking at the percentage, there's a higher percentage of outgoing transfers for cats than dogs. Is there a particular organization you're seeing?
No, it's because we do TNR and Asilomar doesn't, yes, Asilomar doesn't recognize TNR as its own little box.
That's what I thought.
So return field, so those are all lumped in there.
Right.
Yeah,
That makes sense.
yeah. And that'll fix it when you look at Shelter Animals Count. You can actually see the difference between our RTF or TNR cats versus, cats that we send out. We haven't sent any cats really to rescue. So it's been almost all TNR.
Any other discussion on this stuff? Moving on, pain protocols.
Melissa wanted to talk about, or she brought up, we're going to talk about our protocols. And so we put that on as an agenda item.
Yeah, I just asked about it last time and then it wasn't answered, so
Okay.
I thought you could get an answer and the public was.
Yes. So in your packets, our pain protocols are in there. And so these are the current pain protocols, Dr. Sam.
Second thing in the back.
Yes. Any questions, Dr. Sam can answer those regarding our protocols?
Yeah, that's why I'm here, if there's any questions.
Has anyone had any questions from the public? that we want to bring up? Concerns?
Who does the evaluation of the, or who's informed about who does the evaluation on the scale? Is everyone informed on it and the veterinarian does the evaluation?
No, like that's for anybody that's like
Anybody.
this looking at an animal, so like medical and kennel staff. I mean, I don't know how much the front staff necessarily
They're
does
not-
that,
yeah.
but like kennel staff and medical staff use that scale, use those two scales.
And then when Dr. Robertson came out in January when she came out and did her pain workshop with us, she was able, and I brought it up at the February meeting, we had the feline grimace scale app. Sometimes it doesn't work necessarily depending on where they are in the building, but this BAP score is a printed thing, so they can always look at that. So we kind of had two forms, if you will.
Based on the different various areas of expertise in the room currently, does anyone see anything in these standard operating procedures that, suggestion wise, where something can maybe be added or updated or, anything of that nature?
So like, on the days there's non-veterinarian there, does the team have access to talk to veterinarian to get these things approved?
Yeah. They, medical staff will usually, well, they call me anyway, but they will usually still prescribe the pain medication though, if they feel that the animal's in pain. But they usually still call me anyway, but yeah.
Does the medication get put in food if it's oral and not able to be given by mouth directly?
If it's not able to, I think majority will try
We
to,
try to give it by mouth.
right, yeah, but
Yeah.
if for some reason they can't, or honestly, usually with the meloxicam, we just give an injection just to like get the 24 hours on board for most of the time, but yeah, they'll put it directly in the mouth. Or mix it in food, yeah.
Any other comments, thoughts? Seeing none, moving on to community partners.
So in your packet, we just wanted to kind of show a PowerPoint Sarah had done. You may have already kind of looked through it. But this is kind of a PowerPoint Sarah shared with like our volunteers and, when you look at the numbers and we have to all take a second sometimes to pause and celebrate what we do because you get so caught up in the daily, we took in 18 kittens on Saturday. And we get so caught up in that you're focused on that, right? And you don't really see the overall impact of how many animals you're taking in. And despite being managed intake, we had one day we still took in 16 dogs and we didn't have a single kennel. And Gilly and her crew were scrambling, the animal care techs were all scrambling. And we had to like pair dogs up and figure out what we were going to do because these dogs absolutely couldn't be left in the community. And it was a matter of urgency for them. And so it is challenging when we, people have gotten better, I guess, at trying to say that they're an aggressive stray instead of just a stray to get us to take it. And then we find out it's their animal. We had a case like that last week. And that is frustrating to us because, we really are, it is no room at the inn. And, this is, it's cyclical in shelters. Dr. Levy can back me up on this, but we have several seasons in sheltering where we're inundated. Right at spring break through the summer, the holidays, because company's coming. Those are the highest times that we are going to see intakes jump. And of course, kitten and puppy season in there, and then there's that fun, but really kitten season, but as far as animals just quote unquote strays, they're suddenly strays, things like that. And so it is a challenge to get through these next several months. That's why we have the big, huge adoption events like taking animals to Jack's Mega, for that event, which is coming up in June 28th
and 9th.
and 9th. It's a Saturday, Sunday this year, which we're excited about instead of a Friday, Saturday. So Jack's Mega is coming up, and then right behind that, thank goodness, we're going into Summer Lovin' with UF. So that's one of our most successful adoption events, period. And so it's just, we, want to show like we are working with all these groups, all of these, people, all these rescue groups really do try and pull from us and help us. And, it's kind of amazing when everybody that we're partnering with, and then the other thing is what I wanted to share, and I didn't stick it in the packet because we were sorting, okay, up to the last minute, but I'm happy to pass it out to each of you. These are our community vet partners that we do, and a great question was asked of me of how many animals have we sent to emergency veterinarians when they need it. And these are animals that we have had treated for everything from hit by car to they were in foster and went downhill all of a sudden to what happened, or adopters that suddenly the animal crashed after they adopted the animal. We really do try, even though we don't, we are now closed, to at least get them some guidance and get them some help so that that animal has a chance at being saved. And so since I started, or since October of 2022, we've sent 118 animals that have been treated by emergency vets. So that's a lot of animals we do actually get treated by emergency vets, and I don't think the public always knows that. So I was glad to have that brought up. And I did look, got quite a few cats and dogs. It's pretty equal. We do notice on the weekends we get a lot more hit by car dogs, unfortunately. At night, whatever that reasoning is. But we do see more of the hit by car type animals at night during our on-call officer shifts than other things. So I did print one for each of you if you all need to see it, but I was just excited to realize I screwed up this packet. But I was excited to share that information because I do think that's really important information. And we've been partnering with community care vet specialists since they opened a year ago. The sad part was we lost Blue Pearl, who was our most prolific partner. We sent everything to Blue Pearl. We've sent some things to University of Florida. We do not enjoy the same discounts with them as we do our other partners. And so we try not to utilize that service as much, but we're certainly glad that they're there. And then they are a 24-hour care hospital, but losing Blue Pearl was hard because community care vet is not 24 yet. There are plans for them to go 24/7. So I'm excited, but currently they are not. So we have to pick up by 7 p.m. So but I just thought I'd at least take the time and share, and you can see the invoice costs we've spent with them. You can see because again, we don't want animals to suffer, and we want to make sure that we at least give them a shot at being treated. And so we do that. And I get calls all the time, and it's really, we try and just stabilize the animal until they can be seen by the shelter vet. The biggest thing is getting them stable as much as possible. And unfortunately having to make a call when it's too far down the road. So, but I reach out to Catnip now all the time. She wouldn't take a cat that had maggots. I don't know why. But opening it was fine. No, but anyways, and so I just think that that's important, information to share, that we really do try and prevent animal suffering even when we're closed, as much as possible. And we're glad to do that.
Yeah, I don't think most people know about that.
Yeah,
I would like one.
yes. Do you want it the right way?
I
We try it.
but there's a lot of shuffling happening over there.
I know, I'm gonna give it to you the right way, I'll make sure. But yes, if you are interested, please, I do have them. I was trying to do a breakdown of like what the animals were, but since Blue Pearl because some of them don't have the A numbers the same way we list them. So I can't tell what each of them is. Sure. Sounds intact. It is. Oh, no. Spent lot, no, let me just check on him. Yeah.
I'm really glad CCBS is over now.
Oh, they're great. I love them. Love them. You have full. No, I love them. They're wonderful.
How does it work with your, like, when you're closed?
What do you mean?
Like, if somebody calls and you're closed,
They call 911.
they call 911, and then what happens?
An on-call officer is dispatched.
Okay.
So whoever's on call, so my officers work 7 days a week, 24/7, but it's somebody different on call.
No, I just, that's what I'm talking about, the officer.
So the officers go to the scene and assess. If they feel the animal needs to get immediate care, then they take it to one of the vet hospitals. The vet hospital then just calls me to verify that we, what, some kind of plan.
Yeah.
And usually, and they know, like CCBS and of course Blue Pearl did, Florida's a little trickier because it depends, they have so many rotating shifts.
Yeah.
So we've got it pretty established now where I work with their practice manager there and she'll call me and say, this is what's going on, but she's trained everybody now to like, this is all we're doing.
Yeah.
So we're not doing, $10,000 worth of services. So let's do what we can. And then the officer will give them an A number so they know what to attach you to. And then we pick it up the next morning.
So in the presentation, I always like to see the number of the fosters. I know that you've been working on the foster program the last few years.
Yes,
And it's very impressive. That's something I'd really like to see in the new data that can be captured on the
Yeah.
website.
Yes, absolutely. It does come through Shelter Animals Count, doesn't it, Dr. Levy? Yeah, I thought so. Yeah, that'll be captured on there as well.
Your volunteer program and then the fosters, I think, are two things that don't get seen in the public pretty much.
Right.
It's two programs that you've worked hard in the last few years to.
That's on Gilly. Yes, yep, absolutely.
Yeah, that would be good. One.
Yeah.
And then I saw, was it in here? Oh yeah, the hurricanes were some of that was fantastic, sneaky way to increase adoptions. Just put animals in the homes.
Yeah.
So yeah, to the foster program, it increases adoptions.
Yes.
So I think it's a great story to tell.
Hurricane foster
Yeah.
cleanouts are very successful.
Mm-hmm.
We waive all their adoptive fees at our humane society, so if you fall in love with a foster, you're a hurricane foster.
Yeah. We waive fees a lot, so I think April was $4, or May, excuse me, May the 4th be with you, so $4, so, but I mean, so we waive them a lot, it's just, this is a tough time of year for shelters. Right.
Good. All right, moving on to veterinarian comments.
And
That
Doc is gonna just
Oh, I was
share
just
some
here,
stats.
what did you want me to share? Cause I was just here to answer questions.
Oh, okay. I'm just
Yeah,
gonna have you share just the stats so people understood like how many surgeries you actually do in a year and.
well, that's all you gave me was the surgeries.
Yes, I just thought
Okay.
it would be a good, I thought it was just a cool stat.
And then, so it looks like in 2024, we did 1,640 surgeries and 1,604 of those were spay neuter. So then that means the remainder were like other types of surgeries, typically like amputations and nucleations, things like that would fall under those categories. So total was 1,640 surgeries, though.
And I think that's, that's just one vet, so it's like, it's pretty cool to think about how many other surgeries we do. You don't think about those surgeries, but they can be very lengthy, especially on the dogs. With some of these FHOs that come in, they are pretty complicated. So again, it'll go like if they've been seen by the emergency vet and then they come to us and then doc's got to schedule an amputation or something like that. It's like amazing how we have a lot of tripods. running around. Dogs and cats.
They get adopted quicker.
They do. They get adopted the quickest. Yeah, yeah.
Mhm. Or one eye, take, one
Yeah.
eye too.
I do know people who like want to adopt, so I
Yeah.
think.
You may not have this recorded, but is there a general sense of like turnaround on like return to field cats? Like how long they are spending in terms of intake and then surgery and then going back out?
Oh, yeah, I'm not sure on that because they get their surgery done pretty quick, like usually next day or like the following Monday, but with the officers returning them to the actual field, that has taken, yeah, and so I don't know, I guess, how to speed that
I'd
up,
have
because
to-
that is like, they do sit for a while, but they typically within, I would say 1 to 2 days, depending on if it's a holiday or not. Cause
Does
we
that
schedule
build
those
up with
right
their
away.
call load?
Yep,
Cause they have to,
yep.
Yeah.
if they don't have, hey, I don't got time to take Cat back to where I picked it
Yep.
up because I gotta go run these other
Yeah.
calls.
Is that
Well,
something
it's typically-
volunteers have to do?
They certainly could. They'd be more than welcome to. We can certainly see if we can do something like that. It also, it's not like the officers picked a lot of these up in the field. They come in over the counter and then the people are making us return them.
Sometimes they are, over
Yeah.
there. And we do though, if the people are willing to do it themselves, that does happen quicker.
Yes,
because,
it does.
Like Ori will
Kira.
call, like it'll be
Yeah.
pop-up men, yeah, and then Ori will call them directly instead of doing an officer
Right.
call. So if they do, and we do encourage that,
Yeah.
most people will come back.
Yeah.
It's not a huge amount that
It's
say they
fewer
won't do
officer
that.
ones, but it depends on that color too. It's a lot fewer officers than the public utilizing this.
Yeah.
Do you have a county vehicle that volunteers are able to use?
No,
No, so it would be personal vehicles if a volunteer were to
yes,
want to drive across wherever these animals were picked up.
yes,
And I understand that for liability.
yes.
Or not,
Some people, they like transporting animals and that's all they do.
Yeah, we
We
have several that
Yeah.
just do that.
So it might be, it might just need to be publicized or included as an option for volunteers.
just to keep from sitting there.
Yeah.
Cause I know we've gone over the stats before and your officers are very busy running calls, so, but if that helps get some of these.
Yeah, sure they get out, yeah. 'Cause all they do is get sick if they sit in the shelter
Right.
for
Yeah.
Take up space.
a week or whatever, yeah.
Julie, here's a brand new paper.
We just published a paper. We surveyed all of the shelters in Florida about their TNR and RTF programs, including those collaborations where like who's transporting and what care are they getting? And so I just sent a link to that. I think a big take home from it was half of Florida shelters already are doing TNR and RTF, and that doesn't even count, like in Alachua County, we have Operation Catnip doing that. So that wouldn't have been included. So there are certainly more counties offering this to the public than just the shelters. But we were interested because we hear a lot that, especially from municipal shelters, that, you know, their local code doesn't allow it, or, you know, people want to start engaging their shelters and they're anxious. And we're like, oh, this is not a new thing. This is done all over Florida. So it's going well.
Gotcha.
And the big take home that I had from this was not surprising in retrospect, but it was very dramatic, is that the rural shelters have higher intake per capita. So I love to look at data as like number per thousand residents, because that equalizes everything, right? Like a higher population county is going to take in more animals, it's going to euthanize more animals. So just looking at those raw numbers can be misleading. But if you normalize everything to per thousand residents, now you get a better sense. And so our rural counties are taking in more animals per capita than our urban counties are. So they are already like overtaxed, and they have very frugal support. They're small, old shelters. They don't have big budgets. They have low levels of personnel. Most don't have a vet. They're really struggling already, and then they have to take in a higher number of animals relatively. But also we saw that, and so they consequently have higher euthanasia. But we also saw that if those rural counties had a shelter-based TNR RTF program, then their euthanasia rates were less. They were closer to the urban counties. And then kind of our bottom line conclusion, which we've already figured out here, is that the urban centers like Alachua County should be spreading, all the agencies should be working with their surrounding rural counties. Like that is how we're going to solve that problem, not by trying to build up the rural counties with resources they don't have. Like they're never going to have a shelter vet, so that can't be the answer. But we can develop programs that supply those resources. And I know like Catnip has a grant now to help Levy County with their cats and probably others. And I know the Humane Society has a couple counties that they work with a lot to transfer animals in and provide other support. So I think we need to keep that on our minds. The municipalities have a little less leeway of how they spend taxpayer money, but they can still be supportive of these things and refer to the other programs. And I guess one thing we could do in this committee is really like identify all those collaborations so that we all know where to point people for help when they're calling from a rural area.
Do you have a list of folks who are willing to transport, or is that something that could be created? And then when you have a cat that needs to go back out, that'll call and say, you available today? Can you take the cat out?
We could do a general plea. Yeah.
I mean, but like I said, have like an on-call
Yeah.
list of numbers and
Yeah.
go down your list, most available, least available, whatnot, and then,
Yeah.
that just seems like that would be my brain says that's maybe the easiest way to get something going right now. As far as that
We can
goes.
put it on our Facebook.
All right, any other questions for?
So the 1,604 spay neuter, are those all animals within the program, either TNR or adoptable animals?
Yeah,
Okay.
yes. I guess there could be technically some owned in there,
Okay.
like certain cases, so if they reclaim their animal, they come to reclaim their animal, they agree to spay and neuter it. So it's not technically all adoptable, but majority of it's going to be, yeah. Yeah.
Ready to move on? Well, we didn't have any public comment, so there's no response. Does anybody have anything else that they just wanna get out there, from anything we've went over today, or did we miss something today? Anything of that nature? We can kind of use this time while we're together.
I just posted in the chat that I forgot to put on the agenda. Can we have an update on the status of Petzl implementation for post-adopter support?
Yeah, so I have not, we haven't had a follow-up meeting with Petzl. We can probably revisit that again. But I have not had a follow-up. Our returns are so low. But I mean, it does not hurt to add that. We just know that the adopters are not using the current tools that come with Pet Point and Adopt a Pet, and even our training partnerships with Good Pup and things like that. So I mean, it doesn't hurt to look at it again. But we just not seeing great success with the apps that are already out there.
I think you'll find this one's better. It's designed to be much more consumer friendly, and you do get the feedback. I think it's worth a try. The other thing is even like, yes, they see a 20% reduction in returns with this support, but also like just providing people with like an automated like trickle of information for a new pet. So even if it hasn't gotten to the disastrous point of returning the pet, there's helpful information that's provided in a very consumer friendly way that they will use. We're doing a research project with their initial data, like their first year's worth of data from their surveys. It's just really interesting how people use it.
What's it called again?
Petzl, Petzel.
If you do choose to, could you make it available for the Summer 11 event and maybe use it for that, if you do choose to implement it?
Yeah, yeah. Certainly something I can look at, yeah. Yeah, we had the one meeting in February, March,
Yeah, I wrote it down last night.
Yeah.
Think about it.
Yeah.
And after that meeting.
and we have the meeting and then, so yeah, I can find out how to get that and how to get that implemented. I know they're interfacing pretty simple, so.
They make it easy.
Well. There being nothing else, before we get to our last, agenda item. We need to figure out when we're gonna have our next meeting. Historically, that would be like Wednesday, August 13th.
That's right around 7-11, right?
When Summer 11,
Right in
Not-
the middle of.
yeah, do not kill us.
Pardon?
When is Summer 11?
I'm looking,
August
it's at
9th.
first week of August, yeah, August 9th.
It's right after.
It's right after. Are you gonna be recovered?
I should be alive by then.
Okay,
So if
August 13th.
So August 13th, unless we need to have a special meeting, something comes
Yes.
up between now and then. Hopefully same place, same time, if the room is available. Sarah, if you will do the usual arrangements that you always do.
And I will say our admin coordinator, because Gilly has been so buried, our admin coordinator will be taking over staff liaison duties for our committee. So Gilly can just actually Gilly. Work on them, more volunteers and fosters. So once Deb gets her rest of her bearings under her, we will be transitioning. So yeah.
Congratulations, Sarah.
Well, we've got no other business. Do I have a final motion? I have a motion and a second. All those in favor signify by saying aye.
Thanks, Dr. Levy.
Thank you. I'm very sorry I forgot about this meeting, so thanks for getting me online right away.
That's it.
so much.
Thank you.
Things died since decided weeks ago.
Good.
Everyone